not a common tumor at all. I mean, I've done this for a long time. I've seen 2 cases.
Okay, and you talked to me a little bit about the beta blockers, and that's basically just so I'm understanding. You have these receptors which are basically G-coupled receptors, and depending on which receptor the adrenergic or the epinephrine or norepinephrine binds to, it's going to affect what you're going to do. And so these beta blockers, they're blocking the receptor to try and limit the effect that an overproduction of epinephrine or catecholamines are having on the body. Is that what the purpose of those are? Or
yes, it basically stops this catecholamine to affect on the peripheral vascular system as well as the heart. So if you occupy those receptors, the catecholamine cannot stimulate the beta receptors in the heart to basically hyperactivity. It's pretty simple.
Okay, and so just theoretically, would the beta blockers be the target or the primary option, or with the tumor, even though it is rare, once it is classified as this type of tumor, then the beta blockers are basically used as what we want to go into before we do the laparoscopy?
Yes, exactly. You use it and then usually post-op. Sometimes you use it for another 1 or 2 weeks just to make sure that you have no other problems and you stop them.
Okay, but that's usually used as a pre-op and not necessarily as a long-term.
Yeah, exactly. Just pre-op.
Okay, and you said that this was extremely rare. Is it because that it's so difficult to diagnose, or just it's not because of, and that's due to the signs, the hypertension and stuff for that matter, or is it just not? Is it being misdiagnosed, or?
Yep, it's basically it's missed.